If your kid comes home from school with what appears to be a really bad rash, be aware it could be actually something a lot worse. At least 16 kids in San Diego County broke out in rashes, developed swollen feet and hands, and then had fevers. They've all been diagnosed with what's called Kawasaki disease.
Now, it's something many have not heard of, but if it's left untreated, it could be deadly. So here to talk more about it is Dr. Lauren Crosby. She's a pediatrician and an official spokesperson for the American Academy of Pediatrics. So, doctor, we heard this story. Can you just explain for people what is Kawasaki disease?
So Kawasaki is a very rare, so I like people to know it's rare, self-limited vasculitis, which is inflammation of blood vessels, in this case medium-sized arteries, that is seen in kids mostly under the age of 5. And it comes with a constellation of symptoms. So it's not something you can just diagnose with a blood test, for instance. So you have to have it really on your radar and be thinking about it. So it is good to raise awareness about it.
And we got a list of some of those symptoms. Includes fever, rash, swollen hands and feet, bloodshot eyes, swollen lymph nodes, red mouth, and lips and throat. But you say they don't all come at the same time.
Right. So you have to at least fulfill the fever criteria. So greater than or equal to 5 days, and it has to be a real fever, 101 or more. And the thing to keep in mind is these kids are miserable, what we call toxic looking. They look very sick. So a lot of kids, you give Motrin, Tylenol, something for fever, they perk up, they run around, they almost don't look sick. Nothing makes these kids feel better. So that irritability is key as well. And then you have to meet at least 4 out of 5 of these other criteria. So the rash can be a different type of a rash. So it could be like what was in the photos, or they could almost look like welts. So you have to think about that rash. It could be day 4, it could be day 3, it could be day 6. Then you look at the eye. So it looks like conjunctivitis, what people call pink eye, but there's no pus. They're very red. And you get swollen glands, you get changes in the mouth. So sore throat, what we call a strawberry tongue. So it really looks like seeds of a strawberry because it's inflamed.
Well, it kind of looks like foot and mouth disease. You know, like as a parent, I see this and I don't know what it is. And so you say people should be advocates for their kids. Don't be afraid to tell your doctor.
Absolutely.
I think it's something, not what you're, diagnosing.
Right, because you most of the time you'll at least see those criteria, you want to ask about it. So the lips will be dry, you'll have a swollen gland, the hands and feet can peel, be red, be sore, the child may not want to walk.
So if you get it, what do you do?
So if you get it, if the doctor thinks they have it, they're going to draw some blood, they're going to put the child in the hospital right away. If you treat it in less than 10 days, you can prevent the complication that we refer to as something that could be deadly. And what that is, it's coronary artery aneurysm. So the coronary arteries, they bring blood to your heart. So if you have an aneurysm, you can be prone to basically have a heart attack as a child. So sudden cardiac death can occur. So the treatment is something called IVIG. They give it in the hospital, IV, as well as aspirin.
Okay, really quickly, can you prevent it?
So you can't prevent it, you can just prevent the complications.
Okay.
All right. Thank you
Yes,
thank you
of
for
course you
shedding
guys.
some light on
you.
something that I'm sure has a lot of people concerned this morning. We appreciate it.
Yes, absolutely.